Hi, welcome to the Professional Certifications channel. In this video, we are going to explore Sentinel events in healthcare. Sentinel event, an unexpected occurrence involving death or serious physical or psychological injury, or the risk thereof, that signals the need for immediate investigation and response. Scenario: a 65-year-old male patient, Mr. Smith, is admitted to the hospital for a routine knee replacement surgery. He has a history of hypertension and is on medication to control his blood pressure. Event: post-surgery, Mr. Smith is prescribed a pain management regimen, including opioids for pain relief. The attending nurse, due to a miscommunication during the shift change, administers a higher than prescribed dose of the opioid medication. Additionally, Mr. Smith's blood pressure medication is not properly documented, leading to it being temporarily withheld. Outcome: within a few hours, Mr. Smith begins to show signs of respiratory distress due to opioid overdose and experiences a hypertensive crisis because his blood pressure medication was missed. Despite resuscitation efforts, Mr. Smith suffers a cardiac arrest and subsequent brain injury due to lack of oxygen. He survives, but is left with significant neurological impairment. Investigation and response. 1. Immediate response. Mr. Smith is stabilized and transferred to the intensive care unit, ICU, for close monitoring and treatment of his conditions. The hospital's risk management team is alerted, and the event is reported as a Sentinel event. 2. Root cause analysis, RCA. A multidisciplinary team conducts an RCA to identify the underlying causes of the event. The analysis reveals several contributing factors. Communication breakdown: the handoff communication between nurses was incomplete, leading to the medication error. Documentation issues: Mr. Smith's blood pressure medication was not documented in the electronic health record, EHR, correctly. Medication administration protocols: there was a lack of adherence to the hospital's double-check policy for high-risk medications. 3. Action plan. Improved communication: implement standardized handoff procedures, including a mandatory checklist and a structured communication tool like SBAR, situation, background, assessment, recommendation. EHR System Enhancement: update the EHR system to include mandatory fields for critical medications and alerts for missed doses. Staff training: conduct regular training sessions on medication safety protocols and the importance of accurate documentation. Policy review: revise the hospital's medication administration policies to ensure strict adherence to the double-check system for high-risk drugs. 4. Monitoring and evaluation. Establish a monitoring system to track compliance with the new handoff procedures and medication administration protocols. Schedule follow-up audits and feedback sessions to ensure continuous improvement and address any gaps identified. Conclusion: by addressing the root causes identified in the RCA and implementing corrective actions, the hospital aims to prevent similar Sentinel events in the future, ultimately improving patient safety and care quality. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe.